Hi, I'm Dr. Johnny Franco.
And I'm Adam Weinfeld. We are board certified and RealSelf verified plastic surgeons practicing here in Austin, Texas.
And this is how you can tell if you're an ideal candidate for breast augmentation.
We will be looking at videos of real women interested in breast augmentation surgery.
And we'll share with you what you need to know if you're interested in having these procedures.
So let's look at some tapes.
Hi, I'm Britt and I'm 36 years old. I'm interested in having a breast augmentation because I have tiny tater tots, and I've had tiny tater tots my whole life. And I've always thought that at a certain point, my tiny tater tots would be full-grown tots, and they just never did. And then I had children and got tricked into thinking I was gonna have some tatas, but then they went away. And now they're even worse because they're like little pancakes that used to be boobs. I would want them to like sit up. I'm talking like I could have a snack just off of my breasts. So I really do want to know if I'm a good candidate for a breast augmentation.
I think that this patient is a great candidate for breast augmentation, but if you listen a little bit deeper, it sounds like she may be a patient who needs a breast lift as well.
Anytime somebody starts talking about that their breasts have fallen, that they want them a little higher, because the mistake that we see sometimes is people want to put a large implant to replace a lift, and that's not always the case to get what they want, especially since you mentioned that you just wanted them into a better position and shape, which comes from the lift. So this is one of the biggest requests we get, is trying to get that full look, but still be natural and soft. My favorite go-to is using one of the new gummy bear implants, which is a little bit of a slang term for the new highly cohesive silicone gels. And these are really nice in that they can give you some of that fullness without looking overly fake. I feel like it gives us a lot more room to play in terms of sizes for patients.
I'm thinking for this particular woman, a higher profile implant. When I'm hearing that perky, that really sort of almost a shelf of a breast, I think high profile is gonna work well for her.
Especially since she's so thin, because you don't want the implant to be too wide either.
That can be problematic when you can't bring your arms to your side without hitting your breast.
When we talk about the profile of the implants, this is what's really cool, is there's all sorts of ranges to make sure that it fits each patient perfectly. And high profile means that you're gonna have more projection of the implant rather than width. And so this is where we can do, different heights, widths, just to make sure it fits people perfectly.
I think there's a tendency in the past to use a bigger implant to create a lift. And it's certainly the case that you can get some lift with an implant, and you can really
Never
push
as much
the
as you
limit.
want.
Never as much as you want. And really then you may end up placing an implant that is too large for a particular patient's anatomy or their aesthetic choices or taste. So it's always an important conversation to have with a patient.
I always tell people, write all your questions down, because when you come in and you see us, especially when they're as good looking as Dr. Weinfeld, you get nervous, you start to forget all your questions. But I personally, in my practice, love for people to bring wish pictures, because this is something concrete that we can both talk about together. A lot of people will use terms like natural, subtle, round, full. Those things mean a lot of things to a lot of people. And so having a reference point, I think, is super helpful when we're doing the consultation.
And I find that it is really helpful when a patient brings in wish pics where a patient has had a breast augmentation and they know what size implant was put into the person that they are bringing the wish pic of.
You're having them do all the work for us.
I know,
I
it's
love
easy.
Hey, my name's Brittany. I am 36 years old and I have two amazing children. But as we all know, having children, your body changes. I feel like I suffered the most in my breast area. I have a full C and I have kind of a full B, almost a full B. So I have one side that, I feel like I can stick my hand down in it. And then this side, obviously there's no room and we are spilling out everywhere. I am torn on what to do. I've gotten super self-conscious about it over the years. I want to fix it for me, not for anybody else. I live close to the beach and I want to be able to go to the beach and be comfortable in my bathing suit and not feel self-conscious about it. My aunt, she had a car wreck and ruptured one of her implants, and it makes me super nervous about putting anything foreign inside my body, especially because I have an autoimmune disorder. So I just need to know the best option for me. Am I a candidate for a breast augmentation?
Yeah, so this is a really interesting patient. She brings to our attention a problem that we deal with quite frequently with women, that is asymmetric breasts. Now, what makes her really interesting is that the asymmetry is quite significant, about a cup size, if not a little bit more.
This is a chance where we're going to make a big change in her life, because this is something that she's been super self-conscious about. And this is where we get to do a lot of things. Maybe make one breast a little bit smaller, maybe play with different size implants. I think this is where it's really cool. And there's so many implant options where we can really get her to a good spot.
And then she gave us a little curveball, and that was that she said that she has an autoimmune disease. And while there is not very strong data that suggests that an implant can accelerate or enhance autoimmune disease, it is something that we need to talk to patients about, because these are concerns that we hear from them nowadays more often.
This is interesting too, because she voiced a little bit of concerns about having a breast implant. And one of the cool things about breast implants now are these highly cohesive 5th generation implants, which are really, really unique.
The gel itself is almost like a semi-solid. So even if the implant shell was breached, even if there's
Which is hard to do.
Very hard to do. We wouldn't see any of the gel seeping out into the breast space. If you need to take that implant out, it all kind of comes together.
You don't always have to do an implant. You can do lifts, you can do a reduction. There's lots of things you can do to enhance the appearance of a breast without an implant. So many options depending on exactly what they're looking for.
Some women come in and they want to know if they can increase the size of their breast, augment the size of their breast with fat transfer alone, with fat grafting alone? And the answer is maybe. And it really depends on the patient and what their expectations are. I think one rule of thumb is that you probably can't, in most women, increase the size of their breast more than 1 cup size.
And that's assuming you have enough fat. And also too, remember, an implant has a little bit more force to help shape and round it if you have a little bit of a tight breast. If you have a perfectly shaped breast and you're just trying to add a little volume, I think fat transfer becomes an option, but really depends where they're trying to get to.
Yeah, and one of the big determining factors, and you had mentioned one, is do they have enough fat? But another one is what is the skin like in the breast that we're adding to? If they have young breast, much tighter skin, denser breast, it's going to be hard to add enough fat to that breast to give them the kind of result they might be looking for if they're looking for a full cup size or even a cup size and a half. That would really be stretching it. But it's an important conversation to have with patients, and if it's a patient who doesn't want to have an implant, it's a reasonable option.
Now let's watch our final tape.
I'd like to see my breast area looking a little bit more perky because at 64, everything's just going south. But I also lost fullness. I had had gastric bypass surgery a decade ago, and I lost volume as I lost weight. So a little bit of filler in there, besides picking those breasts up, would be marvelous. I don't want to go bigger, I just want to go better. I would like to know if I'm a good candidate for breast augmentation.
So this last video that we watched was actually very interesting. 64-year-old woman who feels like her breasts have fallen, wants to restore some more volume. Also, interesting enough, had a weight loss surgery, which we always take into account. And her biggest goals were just to get some perkier, firmer, fuller breasts. And I think there's a lot of things we can do here.
There are. You know, there's a couple of things that we really need to start thinking about when we think about her age and when we think about the fact that she had lost a lot of weight. We're going to have tissues that don't have the same integrity as younger tissues, and don't have the same integrity that someone might have if they had never expanded their skin and then shrunk it with that weight loss, which I'm so glad she lost the weight. That's going to make her healthier for our surgery. But when you start to think about those factors, you're starting to think lift without a doubt, but maybe even some support for the lift and support for the implant with an absorbable mesh, perhaps.
So one of the hottest topics in plastic surgery are these internal bras, and there's a couple ways to do these, and some of these involve these, what we call a mesh, but these are basically a material that can be placed inside the breast or different levels in the breast lift as well, and basically they're made to support the implant or the breast tissue.
These bioabsorbable meshes have been really, really helpful, especially in surgery in a patient such as this who really needs support and lift or in revisionary breast surgery. The concept here is that in the past, really the only methods, or one of the more frequent methods of controlling the breast envelope on the inside so you can control the position of the implant, was just suturing tissue together, maybe heating the tissue a little bit from the inside. But the problem with that is it doesn't really offer the same kind of strength that we have now. We can do all of those same things and then line that new seam with a bioabsorbable mesh that then ends up getting replaced with the patient's own collagen. and provides a lot of support for that implant, keeping it exactly where we want it.
This is how we can put an implant in. And for patients that just want some more fullness and roundness but don't want to be a ton bigger, this is how we can keep them pretty close to the same size but improve that overall shape.
Yeah.
When thinking about whether there's an ideal candidate for breast augmentation, I would say there's a couple things. Because yes, there is. I think number one, you want to be in a good overall health. I think being healthy, being in a good spot is most important because we want this to be a great experience for you. I think two, making sure that you're doing it for the right reasons. In one of the patients that we've talked to, it was, hey, I just want to change this. I want to do it for me. It's something I've thought about for a long time. Those are two things that I love to hear. I've thought about it for a long time. I've been planning this. I've been wanting this, and I'm doing it for me, because those are the people that are going to be the happiest because they're doing it for the right reasons.
Yeah, I'm so glad you said the for me part of it. Really, when it comes to any cosmetic surgery, it's really important that one of the driving motivations is the patient's own desire to have that body part change, breast augmentation, breast bigger, and that it's not some sort of external pressure from a family member or a friend. A lot of patients want to know about general safety considerations, and I would say overall, breast augmentation surgery is quite a safe operation. When we're thinking about the operation itself, specifically because it's a relatively short operation, it's not one in which we expect there to be a lot of blood loss. While infections do happen, they're quite rare, fortunately. Another safety consideration that patients often want to know about is how long will the implants last? You hear this sort of urban legend about, do I have to have them replaced every 10 years? We know that's not true.
Nope.
But
I would say it's funny because every month we have somebody come and say, hey, I'm here because they hit my 10th birthday of my implants. And I'm like, hey, we'll come back in another 10 years. Because as long as you love them, you leave them. But I always tell our patients, if you come in when you're 25, hey, these probably aren't going to last you the next 80 years of your life.
Yeah.
But as long as you love them, you just keep them.
the reality of it is, if you're young, statistically, something probably will happen either to your perception of the appearance of your breast or potentially even to the implant itself, which will drive you to have additional surgery. That's not for certain, but it's very likely.
And this is where I think having a board certified or RealSelf verified plastic surgeon to help guide you through the process is key, because there's so many options in breast augmentation, and you want this process, and I do say process, to go as smoothly as possible, because it does take a while from the consultation to the surgery to the post-op recovery, and you want somebody that's going to be there for you the entire process, even if there is a little bump along the road.
Yeah. Many patients want to have surgery, relatively soon. That's sort of true for the population of patients who want breast augmentation, but it's always good to pump the brakes just a little bit, make sure that you have all of your questions answered, make sure you understand all of the potential risks, certainly the benefits, the expectations. That's what creates a happy patient.
Are you interested in breast augmentation?
If so, everything you need to know is on RealSelf.com.